So, hi, Kate. Welcome to this interview. Thank you so much for agreeing to do this with me. So, I'll just say a little bit about how Kate and I kind of met. I've been on this whole journey of healing cervical cancer, and then one of the Facebook groups I was on, someone shared Kate's book that she's funding for, and I was just blown away. And I was because I've been thinking about writing a book of my journey, and I was like, wow, someone's already written a book with their journey in it, and has had similar experience, and obviously, so many women have these kind of traumas that come up in their bodies, and trauma from smears and all kinds of things, and it's just not talked about. This gynecological stuff just gets pushed down, and we're embarrassed to talk about it. So I feel like it's time to get the conversation out there. So I kind of connected with Kate through that, and then more recently there's been like a thread on Facebook all about smears and should you have them and all that kind of stuff. So we just thought we'd have a conversation and talk a bit about our experiences. So, Kate, do you want to introduce yourself and say a bit about your book?
Yeah, thanks for having me here, Rachel. So, my name's Kate Orson, and I 14 years ago, I had the Lletz procedure, which removes abnormal cells from the cervix that can become cancerous later on in some cases, but not all. And I just had really awful side effects from the procedure that I'd never been warned about. I had no idea the cervix was involved in sex. I just thought I didn't even really know what the cervix was. Maybe it's something to do with childbirth or something like that. So, but after the procedure, I had a lot of changes in my sex life. I had no desire. Like I felt numb and numb and in pain, and I was just completely confused by what happened because I'd been given no information about the procedure. So I just thought, oh my God, like I must be so messed up psychologically to have this huge reaction to such a minor procedure. And it took me many years to uncover the truth about how this is happening to thousands, maybe even millions of women. And so when I realised it wasn't just me, then I wanted to write about it and share my story with the world, which is a little bit nerve-wracking, but I feel it's also important.
Yeah.
So, yeah.
Can I ask you, how old were you when that happened?
I was 25.
Okay. So was that from your first smear?
No, I don't know. In those days, I mean, because I had smears when I was maybe 18, okay. 17, 18.
Yeah.
I don't know if that's because the age was younger in those days. I know now it's 25, but
yeah, I can't remember either. So what? Just talk us a little bit about what happened. So you get your results and you've got abnormal cells. Do you then go back to the doctors and the doctor kind of tells you have to have this procedure?
Yeah, I mean, I think that I'm not sure of the exact way it's done now. When with me, I had abnormal cells before, and they were like, "Oh, it's the first time abnormal, so don't worry. We'll just give you another smear in a year and see what happens." And then I think it has happened a few times. So then they're like, "Oh, now you need to have a colposcopy. We need to look at your cervix and possibly remove the cells if we think they need to be removed." So that's what happened with me.
Okay. Yeah. So did you feel like was there pressure from the doctor? Is there any alternative given? Is it just this is the route you have to go down? Were you frightened?
I don't know. I was 25 and I think I felt a bit like a child. Yeah. Like, oh, this is what my doctor's telling me to do. I'm going to do it. There was this thing where I didn't tell anyone in my family because I felt like, not my mum or anything, because I felt like, this is something bad. I got this leaflet that said, abnormal cells can be caused by smoking, and I felt like, it's because I smoked when I was younger, and now this has happened, and it's a sexual thing somehow in my head. So I just didn't tell anyone, and I just, apart from like a friend and my boyfriend, and then I just went through and had the procedure. I just thought, well, there's nothing else I can do. I don't know what else to do. I do remember having this idea that I was like, maybe I should Google. I was like, maybe there's an alternative. because, but I was too afraid. I just thought, I don't want to know. I just felt like I don't want to know, so I didn't do that. Yeah.
I think that's the key thing, isn't it? You said you were too afraid, and often we do, you know, when doctors mention cancer, we just go, shit, fix it, cut it out, do whatever is needed. And for me, it's been really interesting because I know we've both worked with Danelle from Cervical Wellness, and you know, I think you've done some stuff with Olivia as well with Self Cervix, where, you know, I didn't feel ready to go down that path for me, but you know, it's that kind of knowing that there's other women who've had this and other women who've healed it in different ways, and some women who do nothing and it just goes away. And that's the baffling one. It's like, wow, what happened there? You know, they just ignore it and go back 3 years later and somehow it's gone. And it's, And for me, I mean, I've been doing so much research and there's so much confusing information out there, which is what I found. I mean, I just come back to the kind of bottom line is that most cervical cancers are caused by HPV, which is now in the UK, that's all they test for when they do a smear. They're not looking at the cells, they just test for HPV. Yeah. And if you've got HPV, then they look at the cells. So for me, I was kind of like, well, okay, so there's this virus that some people's bodies just deal with really easily and throw off. And some people it festers and develops into these precancerous cells and then later on into cancer. And it's also a sexually transmitted disease, which I think for a lot of people, that's where the shame comes in, isn't it? It's kind of like, oh, I'm dirty, I've got this STD. What fascinates me is that men are passing it to us. Men don't get tested. There is no test for men. You know, and I put that to my GP and she just went, oh, well, it's fine because we're vaccinating the boys now. I was just like, well, what about all the boys and men who've already got it and that are spreading it around? Because that was a light bulb moment for me. Suddenly, like, wow, you know, and that was through some of the stuff that I'd watched of Danelle, but also I had a private session with a doctor that works with alternative cancer routes, and she said, you need to take your partner to be tested. And he needs to clear it from his body. And I went, well, how's he going to get tested? And she said, well, you have to use something like kinesiology, which, of course, you know, my husband was just like, what? That's a load of woo-woo nonsense. So I was just like, well, I think the likelihood is that if I've got it, you've got it. You know, it's like we've been married for 15 years. So, you know, it's going to, And I think that's one of the things that I kind of keep educating younger women about is actually it's the boys that have got it. It's the boys that are carrying it around and giving it to you. So, you know, have protected sex. But also for me, it's about really keeping your immune system strong, really looking after your body. Then you've got a better chance of this virus not kind of hooking into you, really.
Yeah. I mean, this is just to clarify. I haven't actually worked with Danelle. I did an interview with her about my book because with my experience, I actually wasn't afraid of cancer, and when I had it done, I really thought of it as a preventative medicine because I'd been told by a doctor when the first time I had abnormalities, it was like, oh, it's not to worry because it can be that you get cancer later in life, that you might get cancer later in life. So I always had it in this mind that I did this because it was like a positive step to reduce my risk of cancer, not that like, oh my God, I'm going to get cancer if I don't do this procedure immediately. And so after it left me with all these side effects, I just felt like, well, I didn't know anything about people like yourself that have cured themselves naturally of cancer or cervical dysplasia. So I just thought, well, I can't let my body go through that again, you know, when I'm not actually unwell. And I knew that I was well before. I felt good. I felt fine. So I just didn't go back and have another smear test after that. And it's not like I recommend that as a course of action. It's just something that I did out of fear. Now I'm more comfortable with my choice because I've looked at some of the statistics around cervical screening and everything like that. But for that reason, I'm not very up on like curing HPV and boosting the immune system and all that stuff. Like I try to live a healthy lifestyle,
Yeah.
you know, to live well. But yeah, it's not an area that I've explored very much.
Yeah.
But
Yeah.
I know I've heard a lot of really interesting stories like yours. So
Sure.
yeah.
So what would you say that you've made different changes in your life? So do you kind of view your cervix as something different? You were saying before you never really thought about it, didn't really know what it was for. Kind of, do you feel a bit more connected in with your cervix now?
Well, yeah, because I guess in its own weird way, like my cervix has been talking to me ever since I had that procedure because I have pain and tension in a part of my body that I never ever felt before I had the procedure. So when doctors say, "Oh, the cervix has got no nerves," then I'm like, "Well, that's strange because I can feel my cervix like all the time now." That's just it's partly pain or an injury, but it's also like I get like a lot of tingling because the nerves try and regrow and like find new neural pathways, and it's not like the pain isn't like overwhelming, but there's just always something there. So I guess my cervix really called me back to figure out what happened to me because it was I went through this time in my life after my sister had leukemia and I had to donate stem cells, and that's kind of what triggered the whole thing because I was in the hospital and I was really paranoid and distrustful of everybody, and I thought, I think this relates to when I had this Leps procedure and all the trauma I went through that, and then I just started meditating a lot because I noticed after donating the stem cells that I just felt really rough, and I wanted to kind of heal my body, and I felt like I needed to. They'd given me drugs, and I felt like I had to clear them out of my body. And then I started to feel my cervix again as I started listening to my body. I could feel all that pain, and that's gradually what made me learn about the cervix and Google and find out that there were other women that were being harmed. And then after that, I kind of thought, well, I really want to try and figure out how to heal because I tried to find a way before, and I hadn't been that successful. And then that's when I found Self Cervix, Olivia Bryant's work.
Yeah.
So yeah, then now I feel like, wow, I feel like the cervix is amazing, and I feel like all our strength and power comes from the cervix. And so everything I do, I feel like it comes from the cervix. It's like guiding me to do all this stuff. And so it's a pretty amazing part of the body, even if you have an injury to it. Like it's still amazing.
Yeah. I mean, I had a really similar experience. So, I mean, I've been doing womb work for years, and then to get cervical cancer, it was just like, what? How can that have happened to me? But it was like my cervix was shouting at me. It was like, give me some attention. You've completely ignored me for years. And the only time I'd ever tuned into my cervix was for childbirth. It's like, okay, you've got to open now, And it was just, So, I mean, I really sat with it. That was my first, I mean, my website's called Hello Cervix. It was just like, hello, hi, I'm gonna listen to you now. And it's really interesting even now. She kind of, I get kind of, I mean, not a pain, like a discomfort. I feel like she's my truth speaker. She really, it's almost like she gives me a little elbow of like, you need to say something, speak up, and, some of the work I've done with other women, it's that connection with our throat. It's like, I kind of see my cervix like a little face with a mouth. And that, it's kind of like, it's our second, throat area. She absolutely is, telling us to speak our truths, and also kind of, dropping into that energetic space where she is a portal between the outside and the inside of our bodies. When we birth, when we bleed, she's opening and closing, and this that kind of amazing intelligent part of our body that so many of us are really disconnected from. And I think that's one of the things that I always say to women, when they're thinking about their smears, or just to kind of really ask your cervix how she feels about a smear. How did she feel about the last one? And for me, I didn't have smear. My last smear before finding out I had cancer was after I had my daughter, who's now 9. I'd done a bit of research because it was so painful and so traumatic. I started doing some research and looking at the statistics, and just decided that it wasn't worth it. It wasn't worth putting my body through that. I also had this feeling of like that, it's this amazing transformational zone where the cells are kind of just almost moving all the time and replicating, and is it good to be poking them? It was like, what's that doing to my body?
Yeah, someone told me that the NHS website used to have information on it when it was a bit more, I feel like it's quite simplified these days, but in the past it was a bit more complex and informative perhaps. And it used to say that the cervix took 3 months to recover from a smear test. And if you have one and it comes back inconclusive or something like that, where they don't get the cells, you should wait 3 months to have it. It's because it takes 3 months to heal. And you never ever hear that now.
No.
Never.
No, that's really interesting, isn't it? And I was also saying that, I remember before when I used to have smears, they'd use like a cotton swab thing, and now they've got this like little plasticky bristle brush, which is really painful. It's kind of like, they've really given it a good scrub. And so I've had so many women contacting me saying how traumatized their cervix feel, all the blood loss they've had afterwards, and is this normal? And it just sounds like nurses are being a little bit rough. I don't know. But, I kind of think, what I did the last time I had a smear was I really talked to my body, and I talked to my cervix, and I was like, this is what's going to happen. I also asked if I could insert the speculum myself, which even then they weren't that happy about. Oh, you might not put it in right. It's just like, oh my God. It's kind of like taking back your power where you can. But,
exactly.
Yeah, I've heard, that was the other thing that kind of put me off smears, was that I'd had women come to me after having procedures like yours saying that their cycle didn't come back, or their menstrual cycle had become so much more painful, kind of all these side effects. And it's interesting because I was talking to a group of young women, and one of the young women said to me, why do they call them side effects? Why not just call them effects? And I was like, wow, it's interesting because they are effects. It's like whether it's a drug or a procedure, there are always effects from all. It's one of the reasons that I chose not to have a hysterectomy and go down the medical route, was just because I'd seen so many women have these side effects where, they might have got the cancer that way, but then it spread to the vagina or it spread to the bowel, or, it's kind of like, I really sat with, well, what's my body trying to tell me with this journey? What's this? Why has cancer come into my body? Let's just sit with that and kind of not buy into the fear and you've got to cut it out quick. It's just like, okay, let's just sit with what's going on and really listen to my body, which so many of us don't do, or don't have the time to do, or don't even know how to start with, listening. And I think pain is your body's way of, trying to get your attention, or just having, like a dis-ease in our bodies. It's, something there is calling. So I just wonder, it's one of the things that came up on the thread was kind of this, smears save lives. And for me, my smear actually came back normal. Which,
before you got diagnosed.
Yeah. It was me pushing the doctor because I had pain and I knew there was something not right. I was like, I want a scan, or I want something, because I know something's wrong. And, if I hadn't listened to my body, it would have been another 3 years before I'd had another, if I'd chosen to have another smear. So, and I met with the Cervical Screening Council in Wales, and they admitted that 25% of smears are inaccurate.
It's only 75% effective. Yeah. Which is something that is mentioned, and I think it's quite dangerous. Like, I want to say that I'm not totally against smears. I think if people want a smear, and then they should definitely go and have one, and it can be a really positive thing to realise that it's abnormal and you might need to make lifestyle changes. Like, I think that's a really positive thing to do. It's not something I can do because I just feel like I just don't want any more interference with my cervix. But I'm totally for smears if people want them. But it's only 75% effective, and it's dangerous not to mention that, because there's a lot of campaigning about smear tests, go and get your smear, but they forget to mention that, which means that women sometimes get normal smears, they ignore symptoms. And there's at least 2 stories I've heard of women dying because they ignore their symptoms because they're like, oh, my smear's fine, it's okay. And then they get a delayed diagnosis. And there's a lot of stuff about how, we need women to come for smears because there's very low cancer survival rates in the UK. And that it's not down to people not attending smears, it's down to the late diagnosis, I think. And so, yeah, you've got to be careful what you read. And because it's not always accurate, it's often written with an agenda, and you have to really look at the facts, and that there's so much misdiagnosis of women that, you have to really, like you did, like know your own body, know when something's wrong, and fight for a diagnosis.
Yeah. And
sometimes.
From the meeting that I had, I said to them, I really want women listened to when they're going to their doctors with pain and these issues, which actually when I googled all my symptoms that came up cervical cancer, I was like, oh my god. But no one I'd seen an acupuncturist, a herbalist, no one had suggested that could possibly be what it was. And even when the doctor said, have you had a smear recently, she didn't say, well, these symptoms are actually symptoms. So it, I mean, I did agree.
Exactly.
I did agree to have one, but then of course to get that normal result. So I said to them, if a woman is presenting with these symptoms and gets a normal smear, can that be followed up? Can you put somewhere in the procedure that the doctors have to follow it up with something else? I mean, I had a scan and I had a colposcopy, and it was the colposcopy. I mean, it was as soon as they put it up on the screen, I was like, whoa, that doesn't look normal. I could see. It was like, geez, it's covered in cancer cells. Oh my God. And for me, I was like, why didn't the doctor notice that when she was doing the smear? Didn't she see how deformed my cervix looks? Bizarre. But, hopefully by me having that meeting, pushing for a meeting with the cervical smear board in Wales anyway, and kind of saying, something's got to change, because, I could have, I would have been one of those statistics 3 years down the line. Who knows? Would have spread. It would have been much harder to clear from my body. Yeah. So there is the thing that about the in the UK anyway, that they don't start doing smears till 25. So we're getting younger women. I mean, I actually had a young woman contact me last year, and she was having what she felt like pain, and she could feel lumps on her cervix, and she went to a doctor, and a doctor said, you're too young to have a smear, you're fine. And I was really shocked that it's like GPs, it's the doctors just don't think that we know our bodies, that they know better than us.
I think it comes back to the late diagnosis there, because I think there's also a lot of confusion. Like, women under 25, like, they're not supposed to have smears because there's a high rate of false diagnosis. But any woman that has symptoms, their doctor should be referring them to the colposcopy and everything. So the fact that they didn't do that is like,
it's shocking, isn't it?
I don't know.
Yeah, it's really shocking. Yeah. And again, I mean, for me, I think there's part of me that feels like the world we live in now is so it's quite toxic. We've got toxins in our food, there's toxins in our environment, there's toxins in our water. We're probably all slightly immune compromised, and then we've got these kind of young people who are having lots of intercourse and kind of enjoying their lives, and not having any awareness of those kind of risks in a way. So in my work, I'm really trying to teach girls about their cervix, get them to connect in, and one of the things that I learned in my work with Danelle, which I knew the cervix moved up and down during the cycle, but I had no idea that when you're turned on, it completely moves out of the way to allow penetration. I was just like, wow, I didn't know it had that intelligence to kind of make space in a way. And I just think, a lot of girls kind of were talking to me about, having sex before their bodies felt ready, and how it was painful, and how they could feel their cervix kind of getting hit. And I was kind of like just giving them that little bit of extra information. might protect their cervix a little bit. So
and just to honour the cervix, because a lot of the work that Olivia Bryant teaches with self cervix is about like that our cervix is trying to talk to us and in us like a sexual situation, our body might not be ready, but we might be overriding that and not listening to it. So when we listen to our cervix, then we can really tune into our body and what it's trying to tell us.
I think that's for me, it's kind of like the overriding. Like, I just say it to everyone. It's kind of like, just ask your cervix how it feels about it. You know, how it feels about a smear, how it feels about sex, how it feels, all of it. Kind of, tune into that bit of your body it's so hidden and just so ignored in a way. But then we have this big spotlight of like, have your smears and you know the kind of, like you said, these campaigns that come out that almost scare women into having these procedures. So I just wondered if there was anything else you wanted to share about kind of your experience with the procedure you had, and kind of if someone was coming to you saying, well, I've had this abnormal cell result and they're telling me I need to have this, what would be your guidance?
I can't really say. I don't really know, because I think for me, because I didn't come from the perspective of healing it naturally, I feel like I can't talk about that side of things. And I also know, there is rare incidences where someone tries everything they can to recover naturally from cervical dysplasia, and then it develops into cancer. So I feel like, because I'm trying to raise awareness about the problems, I don't also want to be the person recommending what someone should do. And I'm not a doctor or a medical professional or anything like that. So all I can say is just do your own research and do what you think is right after reviewing all the research, and take responsibility for your own health, and don't do what I did and be scared to Google and have to just figure it out for yourself, because there are some things that doctors will say, well, there's no evidence to suggest that Leep is harmful towards sexuality or anything like that, and that I just don't think is true. So you really have to take all the expert advice you can find and then make a decision. And it's a tough one. It is. I think.
I'm kind of hearing stories like yours and mine. I mean, I just remember, even from, I must have been in my teens, my mum had some polyps removed from her cervix, and they didn't give her any anaesthesia or anything. They just I don't know whether they cut them off or lasered them off, but she was in agony. And the doctor turned around and said, but there's no nerve endings in your cervix. And she was just
they still think that, though.
She was screaming at him. She was just
I don't know how long ago that was, but a lot of doctors still think that.
Yeah.
And it's in contradiction to the latest research, which is showing that there are nerves in the cervix. So if a lot of doctors don't even seem to read the latest research. So.
No, I mean, that's one of the things that I found very difficult with the first consultant I had. It was a man. I find it really interesting that men go into gynecology. And when I told him what I was going to do, he kind of looked at me and went, how do you know you can do this? And I just went, well, because I've done my research and I know other people that have. And I looked at him and I said, if you had the tiniest bit of cancer on the end of your penis, would you just chop it all off? And he didn't answer me. But it was that, I just thought, God, if they did have that, they'd be doing some more research, wouldn't they? They'd be reading up on it,
Well, they do. They when men have surgery on the prostate, they try and do what they call nerve sparing surgery. So they try and remove the cancer with the least possible damage to the nerves. Whereas with women, they can't even be sure we've actually got nerves. So the difference in the treatment is just huge.
Yeah. And that's something else that I was reading. That some of the new info that's coming out of America is they're connecting prostate cancer with HPV. And I thought, that's really interesting, isn't it? Because it's that's kind of a point in men's lives when they're older and their immune system drops, and it's probably more likely that a virus is going to get in there. I mean, I'm holding a curiosity around the amount of women I know in menopause getting cancer diagnosis. So again, your hormones are kind of all over the place and your immune system's all over the place, and it just feels like our bodies have these times in our lives when they're quite vulnerable to viruses getting in.
Right.
So I mean, my passion is about health and kind of looking after the immune system and kind of eating well and looking after our bodies in that way. But I think sometimes it can be just as simple as that, really listening to our bodies and talking to them, having, it may seem a bit bonkers to some people, but to kind of have a conversation with those parts of your body that are giving you pain. It's like, even if I get a migraine, I'm kind of like, okay, what do you need? And my head just goes, I need to lie down in a dark room. It's really simple.
Really, isn't it?
I need you to get off the computer or stop whatever it is and just go rest, and then I feel better. So yeah.
Can I ask a question?
Yeah.
So because you healed your cancer naturally, then did you go back to your doctors, and what did they say about that, and how that was possible?
It's been quite interesting, because I changed consultants because I didn't want to have a male consultant. It just felt a bit weird. So I changed over to a female one, and the last session I had with her, she was like, well, maybe we made a mistake. And it was just like, so I've got this, I asked for my medical records, I've got this much paperwork going on about my cancer and the tests I had and what grade it is and all that stuff. Maybe you made a mistake. And I only actually saw her like 3 times. So the first time I saw her, she looked at me and she said, well, if you were just coming to me for the first time, I'd definitely be sending you for a biopsy, but we know you've got cancer, so we're just going to keep an eye on you. And then the next visit, it all shrunk down, and she was just like, wow, it's looking pretty healthy. Maybe we made a mistake last time. And I was like, so do you remember last time when you said you would be sending me? It was just like, I don't know, there's just a denial there, I think. So, I mean, I kind of feel like I'm a bit done with allopathic medicine. I just, they don't really want to hear about the alternatives, that there's a different way. I kind of, there's part of me that wants to make a big poster that could go up next to those kind of a smear will save your life one that just goes, or you can do all these things instead. And it is, I always felt a bit sad going in for those appointments, because there's all these women kind of sitting there looking terrified and, just not knowing that possibly there's another way. So, it's a tricky thing to get out there, because it just gets dismissed so quickly. But it's so important that there is another way. Yeah, I think my experience has been that a lot of people just go into fear, and I think it's the fear that kind of makes them just go, oh, I'll just do what the doctor tells me, because of course the doctor knows more than me.
Exactly.
And I think I'm really up for empowering women to make their own choices, around their lives, whether it's birth, health, bleeding, menopause, all of it. It's kind of like, be empowered in your body and listen to it. So okay, so what I'll do is I'll put Kate's link for her book under this video, so you can check out her book. You've got a course as well, haven't you?
So I work with Olivia Bryant from Cervix. We have a special version of Cervix for anyone that's had the Leep Lletz procedure, and I've started a new course, actually, a writing course, which is healing your sexuality through writing and exploring that. So I can share all that with you.
Brilliant. And if anyone wants to know more about my journey, I'll put my website on there as well. So thank you so much for agreeing to chat to me. I'm really looking forward to reading your book.
It won't be too long.
Yeah. Right. Thank you so much. Take care, Kate.
Right.
Okay. Thank
Thanks,
you.
Bye.